Yeah, my name's Andrew Wyborn. I run a company called Greenmash. We're a technology company, and I'm going to tell you a little bit about the work that we do, some of the organisations that we work with, and hopefully explain the reasons why we do what we do and why our clients and partners use our services. Okay, so a bit of background. What we do as an organisation is use mobile technology to improve data collection, reporting and programme performance. So the idea is that we can get data to help people make informed decisions. Typically, the sort of places we're working in are places where there isn't what you'd call a traditional infrastructure. We rely very heavily on mobile networks, and we work with whatever mobile communication services are available. And we deploy a mobile application platform called Mango, which is a software application, software platform that's deployed as a cloud service. And we connect Mango to the local mobile network operators in the countries in which we operate to enable us to collect data, typically from what's called the last mile, so right down to the community health worker and primary healthcare level. Bring data back up into Mango and populate reports, charts and maps in real time to enable people to make informed decisions. So I'm just going to use a couple of examples of a couple of our partners. One is Find, who you may know. They're a not-for-profit foundation working with diagnostic tools to address issues like sleeping sickness, which someone was talking about earlier. And we also, another example is Sightsavers. Sightsavers are a UK-based international charity. They fight eye care problems, preventable blindness, trachoma issues through river blindness and so on. So I'll just explain a bit of background about those guys in a moment, but just to give you a bird's eye view of what Mango looks like in simple terms. If you imagine that blue ball in the middle is Mango, that's where all the magic happens, that's the software platform, so that's where we configure the surveys to request data, where we configure the reports to show the data as information. These blue chunks illustrate the type of channels that we can use to capture data, so we can use anything like old mobile, I had one in my pocket a moment ago, but an old mobile phone, feature phones, we can use SMS, we can use USSD, which is just a small step up from SMS, we can use the latest smart devices, we can capture information through web forms, we can digitize paper, and we can pull data across from third-party applications or third-party systems. On the right-hand side, the green areas are to illustrate the options, the options for pushing information out. So we can push information out through the web interface. We can put information into email reports, either on a schedule or on a event base, and put that information in front of the people who need to take action. We can do something similar with SMS, and we can support pretty much any mobile device. And the orange ball at the top is just to illustrate that we don't necessarily have to stand alone. Typically, Mango is configured to integrate with other health systems, so logistics management information systems, DHIS2, which is a widely used health information system. So we can integrate with pretty much anything, and we also have an application programming interface so other people can sort of plug their stuff into us. So the common thread between all the work that we do, we collect data from some really tough environments. We've never worked in Syria, but we work in Somaliland, Chad, DRC, as well as the quieter countries, if you like Tanzania and Kenya. We take that data, turning into something useful that people can use to make informed decisions, and we can make that information available irrespective of where the participants are in the world, because we're delivering it through a cloud platform. And the aim of the exercise is to improve monitoring management and performance management. Okay, so just focusing on a couple of examples. So I mentioned we're doing some work with Sightsavers. So the work that we're supporting for them is their mass drug administration across a range of diseases, so onco, LF, schistosomiasis, trachoma. With all of those MDA, mass drug administration activities, they were having issues prior to adopting Mango as a tool. They're supposed to conduct a census prior to the distribution of drugs, because you need to know how many people are in each area that are likely to be affected before you know what the coverage rate is you need to achieve, an effective distribution of the drugs. They were having issues with that. There was delay in capturing the census and the treatment data from the field. Some of the data that's coming in was incomplete during the reporting period, making it very hard to manage the programme effectively. Some of these areas very inaccessible, and the end result was they were taking a lot longer than they'd hoped to carry out their census and mass drug administration activities. So how did it, well, I'm not expecting you to read all of that, but just to illustrate the process. So what do we do? The first thing we do is forget about the technology and focus on the problem. So we sit down with the clients and the partners and work through what actually is it you're trying to achieve. You know, what's the disease? What are the issues you're facing? Where's the information got to come from? How frequently has it got to come in? Who's going to collect it? Who's going to view it? Who's going to see it? And we sit down, we draw out, we produce a specification and draw out some simple kind of stickman diagrams to help people visualise how the system might work, or how the process might work. So we go through these steps, agree a process that everybody's happy with, and then what we do, we get into the system itself. So this is a screenshot from within the Mango application, the Mango platform. So we start configuring surveys. So a survey is basically a group of related questions that people respond to in order for us to collect data. So we set up surveys according to the requirements of the programme. We distribute the surveys using whatever the available mobile channels are. It could be sending out SMSs on a regular scheduled basis. It could be initiating USSD sessions on a simple phone. It could be sending people an SMS to encourage them to log onto the system and send their data in. So we have numerous ways of capturing that data. This is just an example of the indicators that Sightsavers used in the initial program in Cameroon, where they were using simple SMS. So each indicator was assigned a simple code. So the data collectors in the field once a week received an SMS saying, can you send your data in? And instead of having to type all that stuff on the right here, total number of men sent to total number of women sent, they just used the code. So A followed by a number, B followed by a number, C followed by a number. That's all we needed. And that information came into Mango through the mobile networks automatically, and within 15 minutes updated reports, charts and maps that made sense to the program managers. So it can be very simple if it's well thought through. The key is thinking it through before you start touching any systems. And the way it worked in Cameroon in this example was we'd set up a short code number with the local mobile network operators in Cameroon, 8005, so people just send their data into a short code number, and that was reverse billed, which meant that the participants, the community health workers who were sending the data in, didn't incur any cost. And then that data comes into Mango and automatically, as I say, updates a rich series of reports, charts and maps that are configured based on the program requirements. So this is a homepage from the program in Nigeria, which is giving sort of key information on the homepage, and then there's other reports that you can drill into to give you guidance on what to do. So here we can see this is a census report, so it's telling us, okay, these guys up here, I haven't got my pointer, but anyway, you can see these guys can start the treatment, these guys need to continue the census. So it's pushing the information, so it's very easy to know what to do. And these instructions are also pushed down to the people in the field. So, okay, you need to continue your census, you need to start the drug distribution. Likewise, we're tracking the consumption of the drugs. So once the distribution starts, there's an initial count based on the census data, so we know how many drugs are going out into the field. And then the community health workers who are actually conducting the work are prompted to send in their commodity data on a regular basis, which continually updates these reports. So again, the program managers can manage the stock. They can see what's going where, how much is being used, how much is being wasted, if any, and how much is coming back. Okay, so the headline results. So the way this started with Sightsavers, we started with a pilot program in Cameroon. These were the results from the pilot program. So they got a big increase in the coverage area, big increase in the number of people treated, early notification of any adverse reactions. They reduced the time in the field by a third, which is a huge saving in logistics and time and people cost. They were able to manage in real time, and they had all of the data available at all of the meetings. So that encouraged them, Sightsavers, to put a business plan together, approach DFID and said, look, we think with some enhancements we can scale this across all of the 20 countries that we run these programs in, and that's what happened. So we're now in the process of rolling that application out across multiple countries on behalf of Sightsavers, and that should be complete within 3 years. Just very quickly, another example with Find. As I've explained, they're an NGO that work with diagnostic tools and deploy those tools in the field. So we started working with Find a year or so ago in Uganda for an HAT, a sleeping sickness program, sleeping sickness elimination program. And the results of that so far have been good, and we're about to start the same program we're about to start working with the same program in Chad, and then Guinea, and then it'll be Angola. And the principle's the same. We agree a process, so in this case it's Find are using rapid diagnostic test kits in primary healthcare facilities, about 150 or so facilities across the affected parts of the country. Patients who are tested positive then get referred up to a microscopy test, who then get referred up, if they're positive, to an LED test, and those patients need to be registered, tracked, and the results need to be fed back to the appropriate people within the program team. And again, we're using the most available and appropriate tools at each stage. So the primary healthcare facility guys tend to have basic feature phones. The guys at the more sophisticated LED centres, where there's more technology available, are using Android devices. The program managers are monitoring this from wherever they are through their laptops or their PCs. And the end result is that now Find have complete visibility across the whole program, which means they can manage it effectively. Okay, but the principle is exactly the same. How does it work? We set up the surveys, so you can see these are the surveys that they have within the program. They can be organised in a way that makes sense to the program managers. They use the tools, or typically we will set this up for them, but they could do it themselves if they wanted to. So you design the survey, set up the messages, assign the attributes, decide when and how you're going to collect the data, organise any workflows. So for instance, this information comes in. If it's above a certain level, this person needs to know. If it's below a certain level, let that person know. There's an adverse reaction, so trigger report to this guy. And then decide how you want to analyse. Do you want to reports, charts, maps? That's set up in the analysis section. And then once you're good to go, off you go and start collecting data. So again, as I say, we can use Android devices, SMS, or this is an example of USSD over here. We were basically pushing simple menus down to a basic feature phone. So it's a very effective way of getting a richer set of data, just using a basic phone and a basic mobile network, and it requires very little training at the community, at the recipient end. They just basically need to answer the questions that appear on their phone. And you tend to find in most countries people are quite familiar with that technology because it's the way they top up their airtime credit and so on. So again, for Find, they have a rich set of reports that come through. These are updated every 15 minutes. They can drill into these, they can expand them, they can extract the data to Excel or any other reporting tool. They can print this data out if they need to attend a meeting. We're tracking aggregated and patient level data. This is just test data, anonymised patient data. So they're tracking individual patients as well as tracking aggregated data to see the impact of the program. Just an example of some of the reports. If you'd like to see a copy of this presentation, I'm more than happy to share it with you. And a summary of the benefits. Well, obviously there is time and effort and some investment required to set up this type of system. So there's obviously got to be a payback. There's got to be some benefits, and the benefits are typically there's a huge time saving. If you get this right, you save a huge amount of time in that data collection and reporting task. Single point of entry from the source, and then all you have to worry about is acting on the data. That in turn results typically in a huge money saving. In the first example I gave, Sightsavers, their estimate was that in that simple pilot at the start, they saved $70,000 compared to the previous year in that same part of the country, and they've seen similar scaled-up benefits in Nigeria. Reducing stock-outs and avoiding overstocks and wastage is a big issue. We automatically generate things like consumption reports and demand reports. reduce training costs. We can exchange data with any other system. So again, single point of capture, enabling data sharing across multiple platforms. Training costs dramatically reduced because we can make this very simple. As long as we get the design right at the start, it dramatically simplifies the collection of data and subsequent reporting. And it's been shown in multiple programs to have a really good effect on staff motivation, program participant motivation, because if you're a community health worker or health worker in a primary healthcare facility, it can be a very lonely existence, whereas with this type of interaction, you can give feedback in pretty much real time to your health workers. So you can send out informational messages, you can give them updates on program efficiency, hints and tips on what to do and all that kind of thing. So it really helps to engage people in the program and increase the motivation levels. Breakdown of the costs. So basically, in simple terms, if anyone's interested, we charge a setup fee, which is basically from the initial conversation about what is it that you want to do, right through to the deployment. We charge a monthly service fee, which is again based on the complexity and size of the system. A small transaction fee, which we don't charge user fees, we just charge, you know, when you're using the system. And typically we'll take responsibility for managing third parties like network providers and so on. So we bundle those costs in as well. And outside of the work that I've described, we get involved in lots of other activities, early warning systems for, you know, disease notification, outbreaks, that kind of thing. We get involved in a lot of supply chain work, managing stocks, enabling people to place orders, enabling orders to be processed and instructions sent through for distribution centres. We do a lot of work connecting up field-based activities with service delivery by distributing electronic vouchers and electronic payments to support the services. We support diagnostic test data, capturing test data results, patient adherence, which reduces loss to follow-up, and we do a lot of management of client-level and patient-level data. So in summary, we capture the data, the right data from pretty much anywhere using whatever available channels. It's fast to deploy because we're not starting from scratch. We're starting with a platform that can be configured. It's typically affordable compared to how things are done prior to our arrival. That's in most cases. And we've shown over and over again it's very effective. So proven benefits, rapid deployment, and we deploy everything as a service. So we take responsibility for, you know, making sure the system continues to work. We provide a service level agreement. We provide all the data hosting and everything. And then and it's very much a partnership. So, you know, we are the technology partner. Our client is out there to deliver the health program, and it's very much a tight collaboration. And there we are. Thank you very much.